Are you a young mother with slight leakage, or maybe an older woman my age, where you're trying to exercise and you just have like really mild leakage? You barely really need a panty liner of any kind. Well, I don't know if you've heard about Bulkamid, but it is one of my favorite surgeries that I do, and it's not even really a surgery, it's like a procedure. Bulkamid that's a brand name for a substance that's made up of mostly water, but also some hyaluronic acid that can be injected in the urethra of the urinary tract to stop mild leakage. It's super easy for the patient. It is an outpatient surgery, so you're asleep for it. You go to a surgery center and go home the same day. And once you're asleep, then I insert a small scope into the bladder, to the urethra, and then I inject this Bulkamid material into the wall of the urethra, and it's kind of like a filler, like you think about movie star lips. So it's kind of just creating a seal inside that tract. So where it's kind of gaping, it brings the walls closer together so that the urine can't seep out. So it's ideal for that mild leakage. And what I love about it is there's no downtime. So you can get back to normal right away. If you have a baby, you can lift your baby. I do another kind of bladder lift, which I also love. It's so good. I've been doing it for 20 years. It's very reliable surgery, but you do have to take it easy for a few weeks when you're healing, because I need it to stay where I put it. I need it to heal in the proper position for the patient to have the best results. So with this, there's no downtime, and it works as well. It's not as durable, so that's the downside. That's the trade-off. So you get something that is quick and easy. It may not last as long, so you may have to do it again in 2, 3, 4, 5 years, or maybe at that point is a good time to do the other surgery that's slightly more involved. I've done several cases. I've been doing a similar procedure. It's called bulking. It's called urethral bulking. Been doing that for 20 years with different materials. But the other materials all had major flaws with them, major issues. They just didn't work as well, and they weren't as natural. So this new material, this Bulkamid with water and hyaluronic acid, it's just so much more natural and so much more effective. I love it. Couple things that you should know about it. If it's a little tricky, because I have to get it to where it's just right, where the patient can still urinate, but they're not leaking. So I err on the side of putting a little less than they might need, because I don't want to put them into a situation where they can't urinate. That's always a risk. And if that happens, the only way to solve that is with a catheter, a small little tube that we put into the bladder to drain the bladder. And in rare situations, I've had this happen once, we had to teach the patient how to catheterize themselves temporarily until things kind of opened up a little bit more. That's a real bummer if that happens to you. I mean, I hate it when that happens, but that is a risk. So you have to go into it aware of that, but recognizing also that is extremely rare. So on the flip side, if I'm erring on the side of less injection, then there's a chance we may have to go back in a few weeks to put more. That doesn't happen very often either. It's pretty cool. It usually is just spot on to where the patient comes back for their post-op in a couple weeks and they're telling us that they are really good. They're not leaking, they're feeling great, they're urinating well. We check with a little ultrasound, make sure their bladder's emptying well, and typically they're doing great. So it's one of my favorite surgeries. I don't know if you've heard about it. I wanted to kind of get the word out about it. Bulkamid is just an excellent option for mild urinary incontinence. Women should not have to live with urinary incontinence. And also the other thing to keep in mind is treating it early is so critical because it will just snowball. It'll start snowballing at some point where it becomes a much more difficult problem to solve. So, hope that helps.